Hey everyone, welcome. Dr. Dawn Siglain here, outside on a beautiful day, and I'm going to be doing some virtual back relief with Dr. Cat Powell, who's going to be joining here any second. So thanks so much for being here with us. We're two Long Island doctors, and happy to get this information out for you on this day. So it's a great way to start the week on a Monday, and looks like Dr. Cat Powell is coming in right now to join us. So thank you so much for being here. I'm a naturopathic doctor and acupuncturist in Huntington. Pain relief is something that I often deal with, and it's always great to connect with other doctors and their other modalities to help people, to bring natural pain relief into your life. Without the use of medications, there's always another way, if possible, if you're looking for that, and physical therapy is a great way to do that. So this is going to be a great topic. She's going to do some exercises with us. So I hope that you guys enjoy. If you have any questions, you can always let us know. So let's see. Okay. That's weird. Okay, I just got an alert on here. Okay, so let's see. So it looks like we're gonna try again with her. So Dr. Cat's coming on here. So there's always something new with the social media. It's fun having, to be able to do these dual interactions here on the live. So Dr. Cat Powell will be here in a second, and we're going to be doing some virtual back relief. So she's going to be showing us some techniques. I actually slept a little weird last night, so I have a little back issue. As an acupuncturist, I use cupping to make myself feel better. So I've got 4 huge purple marks on my back at the moment, but I wasn't able to turn my neck. That's what happened. So my little doggy got up, and I had to go downstairs with her so that she could jump on and off the couch to find some relief for her. So I was bringing her out. So that was my 4 o'clock in the morning. I got woken up and I slept on the couch weird. So I actually had some back pain, ironically, on the day when we're doing this. So let's see. All right. Okay. I think now this is going to work. So we're just it looks like we were having some technical issues here, but Dr. Cat Powell is here, and she's going to be providing her insight as a doctor of physical therapist. So I'm really excited for you guys to meet her and get this perspective with natural pain relief. So if you're able to be in an area where you could do stretching, that would be great. There she is.
Hi. Oh, I think I'm now crooked. Can you see me?
I can see it. Yeah.
All right. Interesting. The other one had me flip my phone, and now this one had me flip it back to vertical.
Oh, okay. Well, yeah, my camera a different way. So is this okay for you? I could
Yeah. This is perfect.
All right. Cool. Yeah, there she is, Dr. Cat Powell. So I was just doing a little intro, but, and telling people, we're going to be talking about virtual back relief today, natural pain relief. I'm excited to have you on here. And I was saying we were both Long Island doctors. So,
Yes.
so if you wanted to introduce yourself and tell everyone about yourself.
All right. I'm Dr. Cat Powell, a physical therapist here on Long Island. Typically, I travel to people's homes and perform the one-on-one sessions with my patients. And now with COVID, to ensure everybody's safety and well-being, I'm also performing treatments virtually. And today, I also launched my new online training program to target back pain and to be able to alleviate it within 30 days. The difference between that and a normal telehealth session is I'm not diagnosing or evaluating somebody there, but it's designed for people who just want to try to tackle their back pain on their own. They want structure to their workouts daily. So all the exercises should not elicit or increase back pain, but I always do screen everybody prior. So dealing with back pain is so common. More and more people have been telling me how just stiff and achy they are from working at home, sitting at home more, and that's why I decided to come up with this program, because people needed that help and that guidance to try and get rid of some of these aches and pains. So typically the patients I treat, very common diagnosis is stenosis, spondylolisthesis, herniated disc, bulging disc, and, I can always touch on those a little bit. And sometimes back pain could be triggering your knee pain. So even if you're coming in for knee pain, I'm going to screen the back as well, or vice versa. And the biggest thing that I always make sure is that my patients don't have any red flags. Every physical therapist will make sure, hey, are you coming in for back pain that's truly coming from your back, or is it something more serious like cancer or kidney disease, and that we need to refer to the appropriate physician? So as just a kind of general public awareness, if you're experiencing back pain and you have bladder and bowel dysfunction, vomiting, drastic changes in weight loss or appetite, severe numbness, tingling, or loss of motor control and function of your arms or legs, or night sweats, those are not typical muscle spasms or joint pain. That's more of a medical emergency, and you need to go get checked out right away.
Right.
So
that's great that you screen for that. So yeah, as a naturopathic doctor, root cause is huge. That's great. How long is that, an initial appointment, if you wanted to talk about that?
So I offer 30-minute sessions or 60-minute sessions, depending on the patient's needs. In person, I typically treat an hour. So a virtual session, again, will run through, their just medical history. I'll screen them for other areas, and then I'll have them move and watch how they're moving, then be able to say, okay, I want you to try this exercise that way, and let's do this and this to see if we can mitigate some of that back pain or that knee pain right away. And then I give them a home program to follow up with and kind of do for the next week. And then let's check back in, reassess how you're doing. Okay, you've done all that, you felt great. Now add this one thing to your program. Some people, as you heal, it's very common to have the ups and downs. And that don't ever be deterred. It's like I was doing so well for 3 weeks and now I had a flare up. It's like, that's okay. That's just, you're not injured again. You didn't damage anything. We just have to reset and ease things back up. And, people then get better, and then they're like, okay, now I'm awesome. I'm 100% and, doing everything they want to do.
Yeah. Healing isn't linear. There's ups and downs. The body's finding its balance and having that support through it. So that's great that you do that. So anyone tuning in, Dr. Cat Powell is a mobile, how we call mobile physical therapist, and now you're doing virtual, but you also do at-home appointments. Mm-hmm. Awesome. And you're I was reading your bio, so your private pay practice is what you decided.
Yes.
Right? You wanted to talk a little bit about that. I think that's great.
Absolutely. And that model allows me to treat one-on-one, as opposed to in the busy mill clinics where you're one of 4 or 5 or 6 patients at a time, and you're kind of just waiting around, like, who's going to tell me what to do next, or the time with the actual therapist is just limited. Then our bread and butter is not just, the hands-on stuff when we are in person with you, but it is the exercise correction. And being movement specialists, we are able to fine-tune these subtle dysfunctions, because you might have somebody who looks like they're doing a great squat from across the room, but we're trained to see, okay, they don't have full hip range of motion there, or the way their foot's collapsing in, or they're starting to, arch their back as they fatigue. And that's where having us be able to see it right away, correct it right away, is what leads to the long-lasting results. And that's not to say people...
Oh, sorry.
Yeah, and that's not to say people don't get better in the regular clinics either. They do. It usually just takes longer. And again, if you want the one-on-one care, if you want the whole session to just be, about you, for you, and for the best possible outcome, that's, what my goal is, to help people.
Yeah. Well, how often do people remember, with conventional medicine, if you go in for whatever one chief complaint is, and then while you're there, like, oh, I also have this, and they're like, oh, we'll do that next visit. But your setup, you don't have to do that, which is great, because you can tackle it. Could be comprehensive in that visit. and you can tailor it to them. So that's a huge, huge benefit.
And that too.
Or out of the visit also, you're prepared and you can do these, you know, the exercise at home to benefit you as well, and you can get everything tackled. That's great.
You're cutting in and out a little bit on my end. I don't know if that's, but
okay.
No, but you bring up a fair point in that too. Like a lot of times people do have more than one issue. And then the insurance companies are the ones that limit me in the sense of, well, you can only legally treat them for their back today. If they want to get their shoulder, we have to stop the back. You go back to the physician, you get a script for your shoulder. We do a whole new evaluation. We stop the back program and we start your shoulder. And it's very black and white, cut and dry. When the person's like, but my back pain didn't end just yet. Like, I'm still dealing with that. So now I have to pick one or the other, as opposed to now I have the freedom to say, we're treating you today, whatever you need. If you wake up with back pain, kind of like you did, even if I was, you know, treating you for your shoulder, it's like, I really did something. Okay, let me evaluate it. Let me work and alleviate that pain. And you still know what to do for your shoulder.
Exactly. Yeah. And when the root cause, when you're asking about things come up. And people go, oh yeah, there's this and that. And then the physician, you know that, okay, you're actually, because as a patient, sometimes doesn't know. They might say something, but as a physician, and we've been trained in this, know to look for something else. So by not within that and that umbrella and the, you know, rigid outlines of what to do, we can use what we're trained to do and then really truly help.
Absolutely.
Huge. Yeah. Awesome. Great.
So recently too, with the studies have been coming out that physical therapy is just as effective as spinal surgery, and over a 2-year period, let's say. And so I always advise my patients too, like, there is a time and place for surgery. However, more often than not, it should be your last resort, especially with spinal surgery, because you have those horror stories of, or I've had patients where I had numbness and tingling down my right leg. I went for surgery. That's gone. Now it's down my left leg. And, you know, it's like, why risk potential complications or other, you know, secondary side effects from a surgery if you will also get the same results and positive outcome by putting in the work and making sure you're not lifting up a bag of dirt incorrectly, because that's
so not for yourself again, right?
Yeah.
How did it happen in the first place? And then talk about root cause. It could have been the way they were picking up grocery bags, and then physical therapy, they guided towards that and steered away from that situation. For example, that could be one, and that could be a huge one. Yeah.
Especially now, everybody's working in the yard too. You know, and even if you're trying to get something done quickly or move it, you know, being able to strengthen the body in proper form and position, you know, the life isn't all, you're not always going to be in a perfect position or form when you're trying to do something. Or, you know, let's say you're getting a kid out of a car and the way you can't make it perfect, but if you're already strong and stable and mobile, your body's able to adapt and be in that less perfect form for a short period of time, lift a load, and take it out. And that's where kind of our corrective exercises and our specific progressions are designed to, again, make the body more resilient and allow it to reset, and for you to be more aware when you are lifting something heavy, and when you do have that control and ability to be in a better or more optimal position, that's the time, hey, just because I go to the gym and I'm squatting and deadlifting in perfect form doesn't mean I should just disregard that when I do stuff at my house. Right. Or, you know, when I'm playing sports on the weekend, or when I'm just trying to do chores around the house.
That's such a huge point. It's all about good lifestyle habits, healthy habits, and the way that we look at ourselves and move our bodies is important. You know, and being able to adapt and do movements properly to avoid another injury, perhaps, or to compound that injury. So you bring up really good points. All really great stuff to think about and to be aware of. You know, and then providing that hope for patients, which is what you do also. You know, but it's empowering. moving the body. How often do you notice there's sensation which leads to pain because there's so empowering, able to help them. This is great what you're offering. It's there needs to be more people doing what you're doing with this and with the pay model, that private pay do it, because you have the ability to do what you do to train people to bring them back to optimal health with their bodies. So awesome. Bravo.
And, yeah, no, thank you. And that's what's great too, because even patients who have had pain for 5 or 10 years in this long period of time, they're like, it's never going to get better. I'm stuck with this. It's like, no, you're not. And then as soon as they start to have those mini successes, because now they're a little bit stronger, now they have a little bit mobility, which they don't care about. I care about as a physical therapist, but their goal is to be able to keep up with their family or to go for a walk without any pain or sit in a car to go visit their granddaughter without any back pain. Those are the goals I'm helping them with. And like you said, once they get that hope and that motivation and they start to see themselves improve, like, it's awesome. And now then, like, they're off to the races. They're really being consistent. They're really going strong. And the other benefit about my model of treating and being private pay is that I can work on wellness then and injury prevention. Because once you're safe enough to get in and out of your car without risking a fall, or if you're able to get your shirt on or reach into the cabinet, but you're still not ready to go back to work because you're an electrician and you have to be in these odd positions or carry certain material or stand on your feet all day, that's insurance cuts you off. And then I have the ability to treat for whatever the patient needs and whatever's best. And my goal is to get them better as fast as possible. And again, the one-on-one allows me to do that. And if they want to continue because they still have these higher activity goals that they want to achieve, but insurance doesn't care because they're safe and they can put on their shoe. Now I can go past that because especially, the more we use our body, there is going to be different wear and tear or things are going to happen. I experience it myself as I'm working out, or I'm like, okay, I'm extra sore. I need to work on this today. And sometimes you just need tune-up sessions. Sometimes you just need a few wellness and check-in sessions just to say, hey, am I on the right path? I started increasing my mileage while I was running. I haven't had any knee pain. Is there anything I should be doing? And, that's really cool to be able to help people as well more freely.
Yeah. Oh, that's awesome. Yeah. So being that resource for people is amazing. That's amazing. So you also, so you're specialized with athletes and active adults, is that right?
Yeah, predominantly. And, that's like whether you do want to play sports in college or whether you are the weekend warrior or you just want to, go walking more, biking more, you just want to add movement to your life. Those are the people I like serving, and I do serve, and I help keep them active, healthy, and motivated to continue doing things and, learn how to address any issues that arise or learn how to, deal with their recurring knee pain or, ultimately try and fix it. But, at least, hey, okay, I worked with Kat. She got my knee pain, very minimal. 2 years goes by and it's like, oh, okay, something kind of flared up a little bit, but I know what to do because I remember what she told me, or I've been keeping up with those exercises. And so now, people have the tools to best help themselves as they, go through life.
Yeah. And you got into it because you're an athlete yourself, right? And there was an injury that you used to set the stage for the rest of your life. If you wanted to share about that, I think that this was a really empowering story.
Yeah, so I grew up playing soccer, basketball, and lacrosse. So I had my share of injuries from, knee, ankle, concussions, wrist, shoulder. But the biggest one was in 9th grade. I tore the ligaments of my ankle coming down from a rebound during a basketball game. And I was told I needed surgery. This was the third bad roll, sprained ankle in, a few months' time. And I was devastated because I had to drop out of all of my spring sports, school lacrosse, travel soccer. I made the Long Island soccer team at the time. So it was very heartbreaking. And I was in a cast, I was on crutches, but I was fortunate enough to have an awesome physical therapist who helped get me back on the field. And from that point on, I knew I wanted to help others just as he had helped me. And I really learned how an injury is not just physical, but it's also emotional. And being able to empathize with patients and understand, like, I know this sucks. Like, you have to think about how you're getting dressed every morning, or just getting to the bathroom is no longer, an easy task.
Humbling.
Yeah, so it definitely humbling. And, I think patients too, when they see that I understand, their frustration, or maybe not their specific situation, everyone's unique, but I know that it sucks, and that my goal is to help it suck less and to actually get better and to, help them in their situation.
Sure. Yeah. Yeah. It is so multifaceted. I always talk about, last week I was talking about the fascia and our connective tissue, and how, working through that, bring up some old memories of something, or old injuries, and you can just remember how you felt and go back to that. And then all those emotions come up, whatever that had to do with, we're so as people, we always like tough, and, this is a straight issue, help me. But when we dig deeper and talk about it, there's so many layers to uncover with us, and there's so many layers within our own tissue and our own body. So sometimes things are, you just aren't as easy as looking at an X-ray or some kind of imaging, and you go, oh, so there's a lot to do, something that hands-on, which you can do through virtual. So speaking of virtual therapy, it's pretty easy to help people with it. I know when I'm doing telehealth, I can see patients now if they have a RAD or acupuncture tongue diagnosis. So I imagine you were talking about, you touched on it before, if you wanted to share how it works, appointment, and the ability of patients and people to help them in real time during the virtual appointment.
Yeah, and that, the biggest, the only difference is just the physical aspect, but everything else I'm doing is exactly the same. Because in, my brain, I'm still analyzing, okay, how did you describe that pain? What movements are, being limited right now? When you're saying I can't do my bra, or I can't, walk more than half a mile. This is some bird out there.
It was beautiful. I knew it was supposed to be thundering around, and I was all set up in my office, and then beautiful, of course. So I came down here. I don't know if you hear the thunder, but I'm like, no. But anyway, go on.
Yeah, there was some dark clouds coming in. It started drizzling. The wind was picking up, and then it was gone in 5 minutes here.
Yeah.
But yapping. But yeah. So nothing really changes, because I'm still figuring out what movements are causing your pain, what other issues might be playing a role in your pain. I'm able to see you move and see how you're moving and be able to correct you right away. And like you kind of said, even past events can impact us presently, or be holding themselves in our body. If you've had back pain for years, your nervous system is now conditioned, like, oh, I always used to get back pain when I would bend down and pick something up. So now I'm like tightening up, I'm bending down gingerly or very conservatively, and now I'm in this awkward pattern. I'm not freely moving anymore. So now the muscles have shortened, everything is kind of saying, oh, that's a painful motion. I'm now on high alert, when there's not any tissue damage anymore. Because an acute injury, only lasts, a week to 6 weeks, let's say,
right,
depending on the extent of the injury. If it's an ankle sprain, or if it's a, tiny tear of a muscle, every tissue varies. That I don't need to complicate things there. But, generally after 3 months, max, if you still have back pain, it's not so much the tissue is damaged anymore. It's likely healed by that point. But now your nervous system is irritated, and you've adapted into these patterns because you were cautious, because it was triggering pain prior. So that's another awesome factor of like, hey, don't wait, until it becomes even more problematic and limiting for you. Let's tackle it right away. Or again, some people, let's say like you wake up, you have back pain. You don't typically have back pain. Maybe, it goes away in a day, but maybe it's still lingering in a week. It's like, well, let's just go in, work on it, give you a few things to try. And it's like, okay, I'm good to go. So that, then, again, a specific exercise program and a certain, movement protocol within the virtual session, I'm able to usually mitigate symptoms and then provide everybody with what they need to continue doing on their own when we're not together virtually.
Awesome. Speaking of which, should we go over some exercises?
Yes. So, I don't know, what type of back pain do you have right now, or what?
Well, mine was, I was on the couch, uncomfortable, and so it was my upper back right there. So yeah, I've got 4. I was telling them before, I've got 4 purple spots on my back that I had done with the cupping, and I think it's actually about to thunder. In a second, but yeah, so that's what happened. So I wasn't able to turn my neck, but then I was able to do that
afterwards.
And that
Good.
helped.
Good. I do that as well, and so starting with, I guess, more the upper back, and then we can move down to the lower back. But doing even a seated cat camel. So you can do this on your hands and knees, or you can do it in seated. And I'm just going to scoot back. And this is kind of like how a telehealth session works. You might have to play around with camera angles and everything, and you're able to see me.
I'm going to let everyone watch. Yeah, I'm watching you. I'm just moving inside because it is thunder here. so I'm watching you. Okay.
Right. So in the seated position, what you'll do is you'll arch your back and look up, and then you'll round forward and bend down, bend the neck. And you just kind of work in and out of this flow. And you go as far as you can. I'm holding on to my knees just as a point of stability. Leaning back. And then we'll also go over how to do it on your hands and knees. So I'm just going to adjust the camera angle here. So for a technical term for anyone out there, quadruped is a position. It's on your hands and knees. It's like a baby crawling. So if it's easier to do this in your bed, that's fine too. But you start here, your shoulders, elbows, wrists are in line, your hips and knees are in line, and you arch up and you round back. And some people might not be able to go as far, and that's okay. And you just work in your best available range. And I always like to incorporate breath to movement. So if you find a position that as I arch back or as I round forward, I'm really stiff here, hold it and take a deep breath and try to expand from the bottom of the ribs out to the side into the upper chest and work into those restrictions. And on the exhale, can you round further or can you extend further?
Awesome. Yeah. I'm always thinking about belly breathing, and with Chinese medicine, that's all about lung qi. So bringing the lung qi gets the oxygen into all the cells of the body which need it, and if there's any stagnation or you can't get the oxygen into those cells, they're deprived of it, and then things can get stuck there, and then that could lead to the pain. So by allowing to breathe, that can provide so much relief in it. So yeah, breath work is huge. Awesome.
Absolutely. And I tell patients too, like that is your key if you've gone too far. If you've stopped breathing and you're tensing up, whether you're stretching or doing an exercise, ease up and start to breathe, because as you breathe, you're also telling your nervous system you're not running from a tiger and you're not under stress. So now the nervous system is able to relax and calm down and allow you to go into those motions that you haven't been able to go into for weeks, months, or even years. And so now it's saying, this is a safe position. I'm allowed to bend my spine segment by segment and round all the way down without having pain. obviously the body is designed to move, we wouldn't start off a lift rounded like that, because then you predispose yourself for injury. So there's a time and place for mobility, stability, strength, and control. And as we combine all of those, that's what leads to optimal performance and function.
Yes.
So,
yeah, because pain is stressful. It sets off your sympathetic nervous system. We're talking about nervous system here. So you feel that pain, and then you can't even think of it, right? You just have like brain fog because all you can think about is that pain. So really relaxing into it, try and release it. That's great. Yeah, and I love the cat cow. Oh, it's so awesome. So great for the lower back.
Mm-hmm. And then,
so my upper back, I could work on the lower back. So yeah, that's a great workout.
Yeah. Trunk cars is another one. It's controlled articular rotation. This is something I include in my online training program now as well. And so you kind of give yourself a bear hug. You kind of squeeze the elbows down and in. And then just slowly start to bend forward. Same thing, you should kind of feel a stretch. And then you're going to start to turn to either side and start rotating. And you're going to work your body in the clockwise or counterclockwise position. So now you're going to work and move into a circle. Kind of forward and back, but with your upper body and trunk.
Oh, okay.
Just the neck. I mean, it's great for the neck too, to do that. But now you're rotating as you come down to the side, or turning your body. So there you go. Turn the side you're facing, come up and back, extend, turn to the other side, and back down.
Got it.
And so that's something to kind of feel, again, where are you stiff? And you can include the neck roll into that. And that was designed for the upper back.
Nice. Yeah, when I had imaging. So the reason why I get tight on my upper back, so like the preposition to it is so my whole spine is straightened.
Okay.
Have the curvature in it.
Yeah.
So I've been trying to get that curve back into it with doing like gentle motion and intox and things like that.
Awesome. Those are great too. Yeah, and just trying to get any mobility. So it's like the next one now is just side bending. So you can either kind of hold onto your opposite leg and side bend away, reaching the arm, or if it's easier, you can just let the one arm relax. And as you do this, you also are trying to reach up and out. I'm exaggerating that as opposed to collapsing down.
Okay.
So you're reaching your arm up and out. You're able to imagine a strong, stable spine that you're lengthening and being pulled up and out and bending to the side. So you really feel a nice stretch here. And then you can play around with kind of rotating the trunk back and forward. One direction might be tighter than the other.
Okay, like the lumbar area?
Yeah, depending on where you're tight, you might feel it a little higher up. And then how you rotate, you might start to feel it down lower in the back too.
Got it.
And that's where I always tell patients, like, yes, if you're doing a quad stretch and you're like, I feel this in my foot or calf, let's say, okay, that's not the stretch. It has to be done differently because we want you to feel it down the front of your thigh. But in other multi-segmental stretches or exercises like this, I always tell my patients, like, kind of that informs movement with your body, tuning in. Okay, we might both be doing this stretch. I feel it a little bit more going this way. You feel it a little bit more going this way. And that's okay, because maybe you don't need to stretch back as much. You're pretty loose on more of the anterior chain as opposed to the back and sides. That's why you need to bend forward more as you reach.
Yeah. That's why, and even day to day, it feel different. So I might be one way, and then another day, and then it just made me think of you don't have to be in pain to check an appointment with the physical therapist itself, because why not establish care? So if there's any little things going on, and then if you do have an acute injury, you just reach out. And then you could describe, and then you don't have to do all the background, establishing care when you're acutely injured. Go right into it. Made me think.
And just
I was like, oh man, it's like you have to like have a whole intake and establish care with someone. That's not the ideal time, just kind of being on top of that with your body.
absolutely. And yeah, and that's exactly it. Of like, things arise, and it's like, hey, you know me, you know about my history. Can you help me out? I just did this to my body, or I woke up with this neck pain or back pain. And that just like we get our wellness physicals, every year, the same thing, which I'm trying to also promote and say like, hey, like get your movement physical, because that physical, yes, they're looking at your blood work, your heart rate, your blood pressure, any other factors that might be going on, but they're not watching you move. And to help your blood pressure, to help your cholesterol, to help your diabetes, that also responds to movement. And so why don't you set yourself up for success? Let's say you're pre-diabetic. Okay, let's get on an exercise program. And I'll make sure that you're doing the safest exercises for your body and what to watch for. Or if you have diabetic neuropathy, the numbness and tingling in your hands or feet, how can we work around that? Or what should you be aware of? Like checking your shoes regularly so that you don't have a pebble in it, you don't feel it, that now turns into a wound, which turns into an ulcer and leads to a diabetic amputation. Obviously, that's
extreme situation, but yeah, but you know what? That happens more often than not.
Yeah.
So unfortunately, so yeah, that's actually a good one to bring up. Yeah, I love that movement physical.
Yeah.
Because there's not one person I think of who doesn't have some sort of pain, in all different layers of tissue, and even it's like a dull something. I mean, it could be something simple as being dehydrated, right?
Yeah.
So you're talking to someone, say, well, it sounds like maybe you're just dehydrated. And there you go. Now you have someone who told you to drink a little bit of water, tell you the amount of you should be drinking, what kind of water you should be drinking. Let's say you're drinking plastic water bottles. Say, no, don't drink plastic water bottles. Plastic water. Drink better, quality water, filtered water, to think about it. So, steering you in the right direction. So now you can avoid something down the line that could have originated because you were dehydrated.
Yes.
And so why it's so important to check in with the little thing. The body, it whispers to you, it talks to you, and then it screams. So check in with a doctor who can help you when it's whispering to you or he's talking to you before it's at you. And then, you're getting second and third opinion telling you to have surgery when potentially, even when it's screaming at you, you can do therapy. But why wait for your body to scream at you when you can do something or be proactive instead of reactive while it's whispering or talking? I love that.
Yes. And I talk to my patients about their sleep patterns too, like their diet, again, water intake, like you said. And obviously, I think as we spoke about in our last chat together, I can give general advice, but I otherwise refer to people like you or RDs, like who are more specialized in nutrition and supplements that'll best help that person with any medications they're on. But I always say, like, hey, if you're eating garbage, you're going to feel like garbage. And you should use food as medicine. And if you start fueling yourself properly, you're going to have more energy. You're going to feel better. You're going to get rid of that 10-year pain you've had, forever. And now you're going to be physically stronger too, and physically more resilient inside and out. And, that's just the whole, picture and well-rounded approach, and then that gets the results that people want.
Yeah. Well, that's great. Yeah. And also, as doctors, we all have our limits and boundaries. And that's why, as a good physician and doctor, you should build up referrals of who to send, because no one's a one-stop shop. And to think that you are, that's just not what anyone was taught in any kind of medical program. Always know your limits. And I think that's a great sign of being a doctor, when you know what your limit is. Go, hey, this might be out of my scope, and still help you in other ways. Go see them, and then let's connect again. Just totally.
And that's where it's teamwork. It's multiple factors that go into somebody's plan of care, and if you're able to just find the person to best help you in their niche and in their world, it's like that's gonna just lead to the best patient care possible, and have every provider together on the same page.
Yeah. Awesome.
But,
did you want You want to do an exercise? Talk a little bit about your
Yeah, so I'll kind of show one. So in my back relief program, again, it's designed for those who just want, 4 weeks of the exact exercises they should be doing. Obviously, I'm not there during your workouts to make sure you're doing it correctly. That's what differs from a telehealth session. But I give a video demonstration for each exercise that you can click on and watch. So one of the biggest kind of back pain causers or back injury that cause back injuries is just how we lift things, and how we, go to pick up a laundry basket, or we go to take the dishes out, or we go to, move a pot in the backyard. So I'm going to move the camera, and it's called a hip hinge. So this is a basic movement. All of us physical therapists teach this almost instantly, or should at least, because this is also your deadlift. So if somebody tells you you shouldn't deadlift, you should run far away from that person, because we deadlift all day long without even realizing it. And I'm not saying you have to lift 500 pounds, but you have to know how to do it safely with even lighter weights, because that's, again, the little by little, then the straw broke the camel's back. It wasn't, oh, I moved, or I picked up the sock, I blew out my back, or I was like, oh, well, I finally had to move something heavy. It was like, well, your back was bothering you, you were doing things incorrectly to begin with, and that was just the final straw. And so we want to prevent that. So kind of back up here. So hip hinging or a deadlift, you imagine there's a bar across your waist, and you're keeping a flat back. So we're not rounding, or we're not extremely arching as we go to deadlift and look in the mirror at the CrossFit gym. Which, again, I go to CrossFit. I love it. They do include a lot of functional movements, but you need to be safe when you are adding weight, and more so. So imagine, again, a bar here. We bend down at the waist. So my back is flat. I'm pushing my butt back. You can always use a wall. So you go to whatever distance, you can tap your butt against the wall. I have a little tightness in my hamstring, so I wouldn't even, and limited ankle mobility. We make our worst patients. So, but you have to know how to work within your available range, because that's what makes a great athlete, or just a more optimal position for your body.
Yeah,
so,
no patients for you.
Mm-hmm. So as I keep my back flat, I'm just tapping the wall with my butt, and I'm not rounding. So now if we imagine I'm going to pick up something, keep my back flat, I might start to bend a little bit depending on the height of the object, and then I pull up, or I place something down into the dishwasher, and now I'm working in this position instead of here. Mm-hmm. So that is one of the biggest at-home exercises you could be mindful of. You don't need any equipment to do it. You're just training your body how to bend properly. Now you're squeezing the glutes at the top, so you're strengthening here. You're not, again, arching, putting the spine at a poor position, or rounding, also putting it at risk. And that carries over into so many functional activities. So I like to start there. I include that, again, in the program. I kind of keep it as an exercise that comes up along with the squat to kind of say, hey, remember, this might have been in week 1 and week 2, but don't forget about it come week 4 in your power stage, where we're now going back to higher level activities or more dynamic exercises. This by no means is a fitness program in the sense of you're going to get bulky and strong. It's more rehab-like in nature, but it is designed to challenge you in these functional positions later on, so that you are able to control yourself, keep your stability, and now start to, reach your arms and legs out in a plank or a bird dog. Or for, let's say, an older population who might not be able to get on the floor, I have different exercises for them as well. So I modify the program depending on who signs up, because I want it to be safe and effective for you and ultimately resolve your back pain.
Yeah. So I would imagine with the appointments, the patient can be like, okay, this is me at the dishwasher. Like, look, and then you could, we don't really know what we're doing. We might think like, we're engaging our core, I'm doing this. You don't have that second pair of eyes that's been trained to look for things, and you're feeling the pain. What a benefit with the virtual therapy to be able to, and then you can, oh, this is how I go and grab, whatever it is in my garage, you come look at it.
Absolutely. And that's literally it. And if let's say we're not on a live session, it's like, hey, just snap a picture later when somebody's home of you doing that activity. And so, okay, you're telling me you get back pain every time you do this chore. Next time you do it, send me a picture or send me a video, and I'm able to get back to them right away and say, okay, this is how I want to tweak, or in our next session, I'll show you what works best for you. We'll try and set it up in that exact location, or just like people's work environments or desks. That too, it's like, hey, just send me a picture of you sitting at your desk all day. Okay, let's adjust the chair height. Let's adjust the table height. Let's adjust the screen monitor to help with your neck and back pain. Or maybe you have wrist pain as you're sitting there. So there's so many ways that we can help. And that's, sometimes people don't even know how we help as physical therapists. Or again, we can help you with not just an injury, but more preventative. Or if you do want that wellness or fitness side of things and preventing yourself from developing these injuries, especially more chronic ones in nature, like that's where you can just reach out and we can get started right away virtually, and figure out the program that works best for you.
Yeah. Oh, awesome. I love it. Well, these are some great tips. So yeah, if you want any final words, just anyone who just signed in or joined us, I hope that you could watch our whole video. We did some great exercises. We're both Long Island doctors here, both doing virtual health. I'm doing telehealth as a naturopathic doctor. And then this is Dr. Powell, who's doing virtual back relief, and she has a new back relief program that came out. And I love these exercises that you touched upon, and all the wonderful benefits of doing virtual physical therapy, and how you get that extra set of eyes, trained eyes, that she can help you with just even doing daily workouts and ways to support the body at the beginning stage, bring the body back to balance as soon as possible to avoid serious condition. Even if you are in a serious condition, trying to avoid that surgery, and physical therapy do it. Finding a trained physical therapist, Dr. Cat, who can really help you and empower you to feel better. So yeah, thanks so much for being here. So you wanted to share, ways that everyone can reach out to you?
Yeah, if you guys have any, again, aches or pains or something you're not sure as to whether I might be able to help you, definitely reach out. You can shoot me a message here on Facebook or on Instagram. My Instagram is dr.catpowell_physio. Or you can send me an email at catpowell@powerfulpt.com. And I'll be happy, to answer any questions you have, or hop on a call for a free consultation and see what's, going to help you best.
Yeah, I love Powellful.
Yes.
You can probably spell that out for people so they know. I love that. Using the God-given name and
I know the technical name, I couldn't do Powellful, but that was like totally what started it. I was like, punny, cheesy, Powellful, that's me. I love it. So, and then the just powerful recovery and actually, inspiring people, inside out and getting those awesome and powerful results.
Awesome. Great. Well, thanks so much. I know that I benefited from these exercises and having this chat. I always love having these wellness chats and, helping people do their best, without having to resort to medications, if possible, being able to use your own body for wellness.
Yes, absolutely. So it's great seeing you, and thanks so much for having me on.
Thank you.
I'll talk to you soon.
Thanks everyone for joining. Bye.